Hi, I'm Dr. James Nill of Nill Family Chiropractic and Wellness Center, and today we're going to talk a little bit about shoulder pain. The first thing we need to do is talk a little bit about how the shoulder works. The shoulder joint itself is called a roll and glide joint. In that sense, it has a capsule around it, but it's freely movable, and that's why we get so many different kinds of ranges of motion with it. So in order to stabilize that, we need the rotator cuff, which is the core group of four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis muscle that help contain that shoulder joint. Now, one thing could happen is if there's a shoulder injury, for example, a sprain in the shoulder or maybe a minor tear, if one of the muscles goes out, the other three have to make up for it, so it causes shoulder pain and dysfunction. So that's why you get a limited range of motion in those areas. Another problem could be the capsule itself, which a lot of times we see with people with arthritis or the elderly, which can actually cause increased adhesions in there and what's called the frozen shoulder or adhesive capsulitis. Another thing is underneath a lot of these muscles is a sac called a bursa sac, which when you have arthritis or it could actually burst, it can actually cause more problems in there and fluid leakage and whatnot, and that's where you get a lot of swelling in the shoulder. And finally, the bicipital tendon and all these tendons in here can actually be strained and cause what's called tendinitis or inflammation of the tendon. So our goal is to try to find out not only what muscles are actually affected, but the weak muscles, the antagonists, or the one that's not so effective or not working properly. And we have to balance that out, which is what I'm going to show you next, is how we can treat shoulder pain. Okay, the first thing we want to do is actually try to get a lot of the inflammation out of the shoulder joint. And what I'm going to use is this machine I have called anodyne therapy. Anodyne therapy, as you can see, has all these little diodes in here which releases light therapy. It's actually 890 nanometers of light, which actually gets absorbed by the red blood cells, releases nitric oxide, and pretty much just dilates all the blood vessels naturally, and it helps flush out all the inflammation, and then the pain will come with it. So with him, we're actually going to put that on, but you can see it doesn't really sit on so well, so I'm actually going to layer some hot packs on top. So I'll just keep it right here. And I'm going to use moist heat, which actually helps absorb a little bit better than dry heat. Now, if you're at home and if you want to try some moist heat, just get a nice hot towel and put it on your back, but don't put it right on. Put it within another towel so it's not super hot, but just enough for it to absorb. Now, he's going to lie here between 8 and 15 minutes, depending on how long he needs his therapy. Okay, the next thing we're going to do is actually come in here with this device, and we're going to do massage therapy with it. Now, I'm using this towel because it actually will help this machine move a little bit. So we're just going to get in here into some of this rotator cuff, kind of loosen some of the muscles up. Now, we also want to do is, which the majority of my patients do, is I refer them out to the muscle therapy clinic across the hall here, and they're going to come in here in at least a half-hour deep tissue massage to try to work on some of those muscles. Now, I'm going to actually come in here and do some myself, and one of the main things we need to do is actually get underneath the scapula, which is right here. So I'm going to have Evan relax this elbow, and then the hardest part is getting underneath here. Go ahead and relax your shoulder. There we go. So once we get underneath it, we can actually get to what's called the subscapularis muscle, which is underneath the scapula right here. When we're done with the massage, I'm going to come and do what's called gua sha therapy. So first we get a little lotion in here. Spread it around. Then we find the spine of the scapula, and we actually come in here. Supraspinatus, infraspinatus, teres minor, and we get in the middle, and this is what's called origin insertion therapy. So what this is doing is help balancing the muscles up on that shoulder and retraining them to work properly. Okay, the next thing I want to do, especially if the patient has bicipital tendinitis, we're going to actually come in here and work on the biceps and triceps. And we're going to actually help stabilize and reset the patterns in the shoulder muscle. And you can tell you that it doesn't feel too good. So when we're done doing that, work around the whole shoulder joint, manipulate that a little bit, It's going to come up, you hear a little pop, and that's it.